Good morning and welcome to COVID Talk with Local Health Authorities. With me is Dr. Maria Rivera, representing Harris County, Dr. David Pearce, representing the City of Houston. I want to thank you to past President Kathy Finninger, Rotary Club of Houston, and a special thanks to Morgan Ash, our producer. I'm Stephen Williams, Director of the Houston Health Department. Let's get started. It's been a couple of weeks since we did this, but we do have quite a few questions. Vaccines. A friend from Canada is visiting soon and wants to know if she can receive her second dose here, as her area has a limited supply. Will a provider sign a vaccine card from another country? Well, actually, that's more of an administrative question, but I'm not so sure that a person licensed here would actually sign another country's card. We could give her a card from us, designating the fact that she did receive a second shot from us.
Yeah, that's a good question. I think we have given shots to people that have gotten the first shot in another country when there's been some people that have moved here or for whatever reason they haven't been able to get the second shot. But I think you're right. We've been giving our own card and then they just can put the two together or something like that. But it has to, for the most part, we try it should be the same manufacturer as the first dose as well.
What is your reaction to the medical staff walkouts because of vaccine mandates? For example, at Houston Methodist, does those numbers impact medical coverage? Those numbers are right at less than 1%, weren't they?
Yeah. Yeah, I think the numbers are really low, and I think that from what I understand from our friends at Methodist is that operationally they'll be able to handle that impact. With a large organization like that, there are nurses that retire. They transfer to other places. I mean, they're shifting all the time. So I don't think it's going to impact operationally. But my reaction to the medical staff walkout is, I think taking care of patients is a privilege. It's not a job. If you see it as a job, I think you're in the wrong line of work. It's a privilege. Patients are people by definition. There's some sort of vulnerability, and we have an obligation to do everything we can to protect them. Remember, the first rule of medicine is do no harm. And so I completely support the Methodist position. And I'm really disappointed that any of the medical staff would feel differently. I respect their ability to make decisions for themselves. And if they don't want to get vaccinated, that's fine, but it's their responsibility to maybe have a career change. I don't think it's right for them to expect Methodists to change things because of their personal decisions.
When will the FDA of Pfizer and Moderna request for full approval? Okay, Pfizer's or Moderna's request for approval. That is quite a process, isn't it?
Yeah, it's a process, and we can't really predict that at this point. I know Pfizer was moving towards it sooner rather than later, but yeah, I don't know that they have a timeline yet.
Yeah, it generally takes months, I think, so it's not quick at all.
Are you offering routine vaccines and testing at homeless shelters?
So with the city, we've been working closely with our big homeless shelters. Gosh, right from the get-go, as soon as testing became easily available, we've had teams in with some of the large homeless shelters routinely testing folks, because that's a congregate setting of people who've got medical vulnerabilities. And so, and we've also been offering a vaccine. We've had strike teams going out to many of our large shelters doing that, and that continues. So yes, we're doing that. How you're doing something similar.
According to TSA, the Biden administration has taken a very close look at vaccine passports for international travel, but the president said there will not be a national vaccine passport. I'm confused. Are states involved in a national discussion?
What we know is that the governor so far here has said that there's not going to be a vaccine passport for Texas, and so that's all that we have heard. But it's something that I know is obviously a big point of discussion, especially as other countries are starting to open up.
I understand a negative COVID test is required prior to boarding a flight to the U.S., even if you have a proof of vaccination. Why not the vaccine?
Well, I don't know specifically why the federal government has that stipulation, but I would suspect it's because there are, and we've talked about this, there are some people who don't respond to the vaccine. And so, and there are people that are breakthrough cases. There are people who have been vaccinated and become infected, but they tend to have much more mild symptoms. And so if we really want to be, preventing the virus from coming in by travel, then you need to be looking for the virus.
This week, the governor said a business cannot ask for vaccine proof. The EEOC provided guidance indicating employees can prevent employees physically entering a workplace without a mask or a vaccine as long as the company has complied with reasonable accommodations. Can a company like a cruise ship mandate something that is prohibited? This all seems clear as mud.
Yes, and I think that is the right assessment. This is, and unfortunately, I think we have to leave this a little bit to the lawyers and the attorneys to figure out what is allowed and what is not allowed.
And I just have to make a comment. I think that this is really mudded by politics. I really do. And it does get pretty confusing. What would be an example of a of a legitimate issue that would necessitate a reasonable accommodation for inability to wear a mask?
So when you look at the CDC guidelines about mask wearing, and it talks about people who don't need to wear a mask, it's people under the age of 2, and then it's people who would not basically be able to remove the mask on their own in the event of an emergency. And so now you're talking about people with severe muscular dystrophy, severe, kinesias, or people who are paraplegic. I'm sorry, quadriplegic. And would not be able to move the mask on. So it's really small number of folks who cannot wear a mask. So the talk of, it makes it hard for me to breathe. I've got asthma. I've got sinusitis. None of those things qualify. So you really need to be unable to remove the mask on your own or be under the age of 2.
According to the Network for Public Health Law, in recent months, at least 15 state legislatures have passed or are considering measures to limit severely the legal authority of public health agencies to protect the public from serious injury and death. Your views, your public health authorities. Actually, this legislation is aimed at your authority.
Yeah, and it's something that we've discussed a lot. Dr. Purse and I have discussed it among ourselves and with a larger group of the LHAs in the region, and it's really unfortunate that this is happening across many states. It's definitely worrisome because I don't think that as public health authorities, we're not trying to impose limits to try just to annoy people or to with bad intentions. We're really trying to protect the health of the public and protect the health of the community. And we are, I think, at least just speaking for myself, I'm worried about some of these laws that are potentially going to pass, some of these changes in the legislation, and what that's going to mean in the future if we have another pandemic or when we have another pandemic.
If I could add on to that, there's, an important part of this conversation is to consider the laws that are in place today. Why are they in place? What was going on when these laws were passed? Because they are decades old, and they go back to time when, measles and polio and Spanish flu were spreading and people were dying and becoming severely debilitated. And they had to put these laws in place so that somebody who was responsible and knowledgeable would be in charge and able to make the decisions. Because when we put it to a committee, like say the legislature or something, then it becomes politicized and tragically uninformed, narrow thinking, focusing on not the health of the public, start making decisions. And so that's why these laws exist. And I think we need to remember that as we move forward.
Having been involved in public health for probably more than 30 years, I don't think people understand the level of discussion and how painstaking it is, even when you're considering limiting behaviors of even individual people, much less populations of folks. It's not like y'all just flip a coin or say you need to do this. It's really a balancing act, and I think people really need to understand that these decisions are not made without thoughtful discussions and oftentimes research and consultations with each other and other folks at the same time. If you have not been vaccinated, are you at greater or lesser risk of becoming severely ill than you were months ago?
So remember, the virus hasn't, the virus has changed a little bit because we got the UK variant here now, which is different from what we had originally. But if you're not vaccinated and you become infected with the virus, it will run the same course with you as it would have 6, 8 months ago. If you're vaccinated, you are likely to have a less severe, but if you're unvaccinated, there's no change. Your risks remain exactly the same as they were a year ago.
Okay, I don't know that you can answer this, but as you know, I ask questions as they are presented. Specifically for the unvaccinated, what is the positivity rate?
I do not think that we have that statistic.
What is the current positivity rate by race and sex? We don't have that either, do we? Will you explain positivity rate so people can have some context?
Sure. So when we talk about the positivity rate, we talk about the number of tests that are positive from the sample, from the number of people that are getting tested. And so one of the discussions that the public needs to be aware right now around positivity rate is that as more people get vaccinated, the number of people getting tested decreases. And just in general, even before vaccination and unrelated to vaccination, we've seen the numbers of testing decrease in our community. And so the positivity rate gives us a good idea of the amount that we're testing. Are we testing an amount in the community enough to tell us something about the virus? And it also just tells us of the people getting tested, how many are positive.
Thank you. Are public swimming pools safe this summer?
So, interesting question. So the last year when we closed the pools, before there was any vaccine, and the concern was that kids historically with most viruses tend to spread virus pretty easily one another. But also in the pools, the other thing was that there wasn't any risk of the pool water. It's that kids get water in their mouth, they start coughing a lot, and they would be spreading the virus to each other. This year, we know a lot more. We know that generally most kids who get sick do fine. Now that's not 100%. There are some kids that get hospitalized, some wind up in the ICU, and tragically we've had a very small number, but some kids have died. So the risk is not zero. But those who are at greatest risk for the kids who, if you spread it kid to kid in the pool and they went home and infected grandma, well, grandma is, for the most part, is largely protected. We've got very high vaccination rates in the elderly. And so the pools are always safe in quotes because we have other things that go bad in pools. But in terms of spread of virus, since there's no vaccine for those under the age of 12 yet, the virus could potentially spread easily amongst the kids, but it's less likely that they will then go home and spread it to somebody who's vulnerable because those folks are largely vaccinated.
Threat level now in Harris County is yellow. The new case trend indicator is not met. What else will move our threat level?
Yeah, so the main thing that is keeping us in yellow at this point is the number of new cases that we're seeing. And so the goal is for us to be below 10 per 100,000. Right now we're in the 30s, and the case trend has really remained flat over the last couple of days, and even a slightly increase. And so right now we're still in yellow. We haven't seen a big jump, luckily, but we will need to continue to vaccinate more people. We'll need to especially vaccinate the young people, especially vaccinate the teenagers to really continue to see that decrease.
Texas is still listed as under the national share of vaccinated people. What is the cost?
Under the national share of vaccinated people.
Well, actually, basically, I think what they're saying is that in terms our vaccination rates are low compared to other states.
Yeah. Well, it's certainly not for a lack of trying on the behalf of those who are pushing out vaccine. I think we've got a couple things. One is we are still working, we in public health are still working to get to those folks who want to be vaccinated, but they're having a hard time getting to the vaccination site. So these are largely people who've got mobility issues and so on and so forth. We also are fighting a pretty healthy conspiracy theory and vaccine hesitancy here in Texas because this has become politically motivated. And that's probably the biggest challenge that we have. And then the third group, and I've had the opportunity to speak with some folks, they want to get vaccinated, but they're the sole breadwinner for their family and they're working 2, sometimes 3 jobs, and they just can't find the time to go and get vaccinated. And so again, that falls on us to be more creative and try to figure out ways to make it so those folks can get vaccinated. And I think this will change, or it's changing now as we're seeing the commercial pharmacies have got vaccine. So that should make it easier for folks to get vaccinated who still want to be.
Large indoor gatherings with singing, like at choir practice, safe? Yes or no?
It all depends on how many of those in the choir are vaccinated. There are, we visited a school a couple of weeks ago, and the entire choir team had already been vaccinated of the teenagers. And so in those cases, practice is safe. They can gather, they can sing together. If you have a group of 25 people and 20 of them are not vaccinated, then it is one of those, it is a high risk activity for transmission.
Thank you, Dr. Maria. I tend to get regular colds in the summer and fall, which did not happen with my mask on. Can you specifically specify exactly what symptoms and length of time should cause you to think it is more than a cold and a test is needed?
So I'll take that one because I'm one of those people who gets colds on a regular basis. And I too did not get a cold this past year. And that's the first time in decades that has happened. A couple of things. One is, if you're somebody who gets colds on a regular basis, you know what your colds feel like. And colds are colds, a lot of nasal congestion. With COVID, there's a whole big smattering of other symptoms that people get. And so the COVID, from my experience and talking with folks who've had it, is not, they're not going to confuse it with a cold. So if you have something that feels different from your cold, then you need to go ahead and get tested.
While attending a large crowded sports event with a mostly unmasked audience, I was about to have a full-blown panic attack. Have there been more stress-related patients presenting themselves to doctors?
So in general, yes, we've seen, if we just talk about mental health in general, we have seen the higher rates of anxiety, higher rates of depression across the country. We've seen higher rates of suicide in some locations. We have seen that, unfortunately, in the county. We've seen higher rates of substance use as well. And so there's definitely, there's a lot of collective trauma that has happened in our community, and especially around anxiety. There's been a lot of anxiety and a lot of increase in anxiety throughout the community.
I went to an event this past weekend, and most people at the event were unmasked. I started to experience some of that. Of course, I kept my mask on a good part of the time. I then concluded that most people in the room were probably vaccinated, just kind of given the nature of the crowd. But I can certainly understand. But I believe that, you need to actually think about which venues you're really comfortable in, and maybe not participate or present yourself in an environment where you believe would present a certain level of risk. What is the difference between positivity rate and for those vaccinated or not? And I think that was a repeat question. And we said we didn't know the answer to that, right?
Yeah. But it's lower.
Yeah, and we most likely, actually, yeah, we don't know the answer to that, because if you've already been vaccinated and you're exposed, you don't have to get tested. But if you're going in for medical procedures and things like that, then they're testing everyone regardless of vaccination status. And so at this point, we don't have it separated out between vaccinated and unvaccinated, but I agree. If you're vaccinated, the chance that you'll be positive is significantly lower.
HISD just announced they are deactivating their communicable disease plan as of August the 2nd and returning to normal. Any thoughts about the fall school year? Well, we're certainly encouraging vaccinations of those kids who are eligible, aren't we?
Yeah, and I can take this one, Dr. Purse, if you want. I know that I've been doing a lot of work with the schools. So it's tricky. I think that a lot of schools are asking us recently for guidance, and the CDC is going to put out guidance for schools, and we at the county are looking to put out guidance for schools. Our recommendation still is going to be, if your child is unvaccinated and they're over the age of 2, we would still recommend masking. We know that the schools at this point, based on what the governor's orders have been, cannot mandate masks for anyone in the schools. And unfortunately, there's also some restrictions as to how many people they can't have limitations on the number of people that are back. And so the majority of the public school districts, if not all the public school districts, will be back at 100% capacity. And so if your child is unvaccinated, my recommendation would be to continue to recommend that they mask. And then if your child is eligible for vaccination, then absolutely get them vaccinated. We're doing a lot of work and a lot of big pushes to try to get as many kids vaccinated, working with all the school districts, working with private schools, Catholic schools, et cetera, to get kids vaccinated. And I think the goal also will be, Pfizer is hoping to ask for the expansion of the age groups under EUA sometime in the early fall. They're saying sometime around September, potentially down to even age 4. And so if we can get as many of those kids vaccinated, then the schools will be even safer. But I think we are concerned that if schools go back to 100% capacity, there's no distancing, there's no masking, and the rates of vaccination are low, that is not a good situation.
Yeah, I'm anxiously awaiting for authorization, at least down to about 5. Spoken as a grandfather. My niece and her family still refuse to get vaccinated or wear masks. Now that masks are not required for those vaccinated, should the rest of us keep masks on, or is that unnecessary?
That's a complicated question to some degree, because certainly if you're vaccinated, you're very well protected, but it's not 100%. For those folks that have got immune system problems, who are on immunosuppressive medications like a organ transplant or a chemotherapy patient, or somebody who knows that they have a weak immune system, or somebody who's particularly elderly, your chances that the vaccine will provide less protection gets higher with those complications. So if you're around your family members that are not vaccinated and they refuse to wear the mask, you can. It's always your right to wear the mask if you want. Remember that the simple face mask that you wear provides some but not total protection. And if you can get an N95 mask, that will provide you significantly higher protection from becoming infected. The face mask we recommend is worn by those who are unvaccinated to keep them from spreading. It does a much better job of keeping someone infected from spreading than it does in protecting someone from becoming infected. The N95 does that.
A related question: might those of us who are fully vaccinated have a false sense of security when in fact we have low antibodies?
So okay, so like I just said, for most folks, the vaccine provides very high protection. There are some people who have no risk factors for it who just don't seem to respond. That's just a strange thing about them. But again, the folks that are on immunosuppressive drugs, organ transplant, chemotherapy patients, people who've got inherent immune deficiencies, and then the elderly, there's a chance that the vaccine may not protect you as well because your immune system just doesn't respond to the vaccine like in most other folks.
Are we learning anything new about those of us who had no reaction to either shot?
I think the question is probably relating to if you had no reaction or no symptoms with either shot, did the shot work, basically? And I think that what we know so far is that yes, that there doesn't seem to be a correlation between whether or not you had symptoms after your vaccines and whether or not it worked.
Okay, a recent study shows the level of antibodies that can fight that variant are lower in fully vaccinated people and much lower with one dose. The Lancet Vietnam variant. That's just a statement, I would assume.
Yeah.
At what level of measurement should a blood test show that antibodies are still high enough?
So, so when you get your antibody test, most of it, it's either a positive or a negative result. In the research labs, they're actually looking at specific levels. So, Dr. Bear, unless you know something different, I think most people are just getting a positive or negative result.
Okay, no, I agree. I agree. What we call titers and what those levels and numbers are is still being determined.
Since your last program, the World Health Organization has changed variant names to letters of the Greek alphabet. British is now Alpha, South Africa Beta, Brazilian Gamma. What is the Delta and Kappa? What about the new variant from Vietnam? How does the vaccine work on them?
So I'll take that one. So the Delta is the variant from India. And what recently just came out this week is that what everybody's calling was the new variant from Vietnam is actually the World Health Organization just came out and said that it's actually just a tweak on the India. So it's still going to be called Delta. And in the laboratory, the vaccines do provide good protection against the Delta. We're waiting to see in real life if that's the same thing. And in particular, right now what's going on in England is there's a lot of the Delta variant spreading in England, but it appears to be mostly amongst the unvaccinated, which suggests that the vaccines are protective against the Delta.
Very quickly, can you explain bone marrow plasma cells, quiescent plasma cells, humoral antibody response?
I don't know that we can do that quickly at all.
You're going to have to because we got 3 minutes.
So all of those, so they're all different types of cells that work within your immune system when you are exposed to a pathogen, or when you are exposed to what we call an antigen, to a protein or something, to create a response and create antibodies to protect your body. So all the cells that were mentioned are part of the humoral immune system to basically make antibodies.
That was pretty good. 20-second COVID test. What do you think of that? I got 3 more questions, y'all, in 2 minutes.
I'm not familiar with a 20-second COVID test.
How long before we see a universal vaccine for COVID and influenza? We're not sure about that, are we?
We're not sure. The pharmaceutical companies are talking about it, but
They're 2 completely different viruses, families.
Yeah.
So
Is an antibody test only done through blood testing? If so, why not add that to every regular annual exam?
I think for now, because it's a yes or no, we're still trying to figure out how long the antibodies last. I don't know that it makes sense yet to add it to an annual exam, but it may well be in the future, especially as we try to figure out if we're going to, how often we're going to have to get boosters, et cetera.
Yeah, but there is a discussion about adding COVID vaccine to the annuals.
Yep, absolutely.
So one thing, this kind of goes to the earlier question. I know we're out of time, but if months later you test for antibodies, that level may be very low, but that doesn't mean you don't have immunity, because there are cells in your bone marrow, going to that earlier question, that sit in your bone marrow that are just waiting for the infection to launch into action. And so you may have great immunity, yet test low for antibodies.
If I donate blood, will they do an antibody test? I know at the blood center, they do.
Yeah, the Red Cross is doing it.
Because I donate blood and platelets and everything else every so often. Well, it's been a couple of weeks since we've been together, and it seems that there are still questions that are coming in. I want to thank Dr. Maria Rivera from Harris County. Welcome back, Dr. David Purse, representing the city of Houston. Special thanks to Kathy Finninger, Rotary Club of Houston, past president, and our producer, Morgan Ash. I'm Stephen Williams, the director of the Houston Health Department, and thank you for joining us for COVID Talk with our local health authorities.